Assalamu alaikum and a very warm welcome to Natural Health on Deen TV with me, Dr. Fatima Paruk. Join us here each week on Natural Health so that we're able to familiarize you, our viewers, with the expanding world of alternative and preventative health by introducing you to diversity of different practitioners and therapies, as well as health-related topics from a natural health point of view. I look forward to bringing you up-to-date and interesting health-related shows that enable you to make informed choices about your health and keep you abreast of the many natural health therapies that are currently available here in South Africa, their individual benefits, and how they can be used effectively for specific health-related issues. Joining us today in studio, we are fortunate to have Dr. Deen Naidu, a fellow homeopathic practitioner who qualified at the Durban University of Technology in 2004 and who currently runs a successful practice here in Durban and has many success stories in treating weight loss and metabolic conditions. Join me in welcoming Dr. Deen Naidu. It's lovely to have you here today on Natural Health. Metabolic conditions are often linked to weight gain in patients. Can you tell us why this happens?
Okay, obesity and weight gain are linked to at least about several serious conditions, right? With the increase in weight, it can lead to hypertension, diabetes, it can lead to certain types of cancers, osteoarthritis, gout, even gastroesophageal reflux disease. We find patients have a very common condition called sleep apnea. And in sleep apnea, what actually happens is that with the increase in weight, that patients actually stop breathing for short periods of time. And this can be quite a serious condition. So weight gain in patients are linked to many conditions.
Insulin resistance is a diagnosis that seems to be gaining a lot of popularity in the media. Can you tell us a little more about it?
Fatima, if I could explain insulin resistance very easily, I would use the term insulin being like a key, and the receptors on the cells like the liver and the muscles as the lock. So in a normal healthy person, that key is able to unlock that lock and allow glucose to move from the bloodstream into the cells. Unfortunately, when you become insulin resistant, this key no longer works on that lock, right? And what actually happens is we have a buildup of glucose in the bloodstream and not going into the cells. So one of the first things that patients present with is fatigue because they're not getting glucose uptake in their cells. That circulating glucose can be converted to a cholesterol called triglyceride, and it can be stored around the abdominal area, around organs, or inside organs, like even your liver and your pancreas.
Okay. So, how is insulin resistance diagnosed?
That's a very good question. It's not a very easy diagnosis. There are blood tests. You can do something called the fasting insulin levels, and that will tell us if you have excess insulin in your system. We also use corroborate that with clinical findings. So obviously there are certain signs and symptoms of overweight people, especially central obesity, which is fat around the tummy, right? And there's a medical condition called acanthus nigricans. And in this condition, what actually happens is we have a darkening around at the back of the neck, under the armpits, in between thighs, under female's breast, there's a dark line that forms, right? Even in fair-skinned patients. Now, as the insulin resistance progresses and that gets worsened, we find that the dark line actually has a velvet texture to it. So there's clinical findings that we find, and then we corroborate that with fasting insulins, HbA1c, which is a test for a 3-month glucose levels. Patients doesn't necessarily have to have high blood sugar levels. So that's why I say it's very difficult. A patient might be putting on weight, go to their normal general practitioner, have their blood sugar level checked, and the sugar levels are fine, but the insulin levels are actually the problem.
Are there any other ways that these insulin resistant patients present to you? And does this develop slowly over time or just suddenly?
I think insulin resistance can exist for a very long period of time, and from my experience in practice, it's something that's that's not misdiagnosed or goes undetected by most practitioners. Patients present with lots of things, from firstly weight gain, fatigue. We see a lot of patients with fatigue. In females, we see a lot of medical conditions like the polycystic ovarian syndrome and so forth. But the most important thing is that patients will continue eating the same way they've been eating for the last 10, 20 years, but suddenly start picking up weight. And they can't explain what is the cause of it. They haven't changed, their lifestyles mainly or whatever. It's just that you'll find them saying, doctor, since I've reached 40, I've been putting on weight. Since I've reached 50, I've been putting on weight. So those are the cases where you need to screen. One of the things that I normally routinely do is, as part of my normal screen where I check cholesterol and diabetes, I send for fasting insulin. And you can say 8 out of 10 times we find that the fasting insulin is raised.
Okay. Can you tell me, patients that have insulin resistance, is there hope for them to manage this without medical intervention through maybe diet or exercise?
Yes, definitely. I think from a natural point of view, you need to be with a practitioner, whether it's a homeopathic doctor or an Ayurvedic doctor or traditional Chinese medicine and acupuncturist, that you need to firstly be with them, right? Patients need to understand that changes need to be made, because whilst you might have the genetic predisposition to insulin resistance and diabetes, it can be managed with lifestyle modification and diet, and obviously medication. And that's where homeopathy comes in quite, it's very good, because what it actually does is it balances off the hormones and assists in reducing the insulin levels, and thereby assisting with the patient losing weight and returning back to the normal state. So you can, at some stage, you can improve the insulin resistance, and over a long period of time with lots of exercise, there are certain patients that are able to reverse it altogether.
Are there different degrees of insulin resistance? And for the viewers out there, at what stage does one need to start seeking medical advice?
I think when we talk about different degrees of insulin resistance, we talk about the rate of how much of insulin is circulating. You get a mild insulin resistance, and then the picture develops. So the patient starts to eat, they'll be craving, your body will actually crave carbohydrates. So they'll be eating a lot more pastas and potatoes and junk foods and cool drinks. One of the biggest things that I see in my practice now is that with the fatigue that comes with insulin resistance, there's a big hype around these energy drinks and cool drinks and stuff like that. So we find the patient will tell you know what, I need these energy drinks. I need 3 or 4 of these energy drinks every day. And that actually worsens the condition, because as they increase in their weight, we find that they develop a condition called non-alcoholic fatty livers, where fat actually gets deposited inside the liver and it affects the liver function. Fat can also be deposited in the pancreas. And these conditions now worsen the resistance. So when we're talking about stages, we need to look at that you have mild insulin resistance. It can worsen as you do not exercise, you live a sedentary lifestyle, and you eat all the wrong types of foods. Mm-hmm. So your weight gain actually worsens the insulin resistance. So
it's actually towards the latter stages that one needs to then start, using some kind of medical intervention to treat this.
I think insulin resistance should be, treated whether medically or through natural practitioners at any stage, because we're finding insulin resistance at a very early stage. My youngest patients with insulin resistance are at 8 or 9 years old, right? I find that there's also a shift in our community. A lot of people with more disposable income are buying a lot more takeout, a lot of more fast foods. So, children are now starting to, it's a norm on a Friday night to go out and get takeout, or, weekdays to have the takeout. So this is now breeding that new breed of insulin resistance. We're seeing insulin resistance at a very early stage now, whereas previously it was adult onset or type 2 diabetes, mm-hmm. where you'd see it in your early 30s or mid 30s to 40s. We're seeing them much, much earlier now.
So basically we're saying that when you start presenting with these symptoms, and if you suspect insulin resistance, it's the best idea to start treating it as soon as you can, because it will actually just develop.
Yes.
And the effects are quite harmful to your body, your liver, and so forth.
Yes, and also what we want to stress here is that if you have family history of diabetes and things like that, you're a candidate for insulin resistance. Okay, so if you have mom or dad, and doesn't necessarily, can even be your grandparents and things like that have had diabetes, you need to now check and make sure that you're not gaining weight. And the first places that we'll find is that central obesity, as I spoke about, around the tummy and things like that, right? We find that a lot of women are what we term pear-shaped. So they'll be small on the top end. When the hips and thighs and the buttocks areas, you start putting on a lot of weight. So these are candidates that needs to actually go and check their levels and ask the general practitioner to do a test. So there's a simple fasting test that most labs can do as a screening test, and it can tell you what level your insulin level is.
You spoke about non-alcoholic fatty liver, and this tends to develop in insulin-resistant patients. How detrimental is it to their health or maybe their liver function, let's say, long term?
I think long-term non-alcoholic fatty liver can turn into a very serious condition, right? We're finding that it is very common right now, and that's one of the reasons why patients will try to do diets and never succeed. You know, they'll try something, it'll last maybe a month or two, and then they're back again because they are not focusing on the liver itself. We find that people that consume a lot of red meat, a lot of cheeses, a lot of foods that are high in fats will be deposited into the liver. The long-term effect of this has an effect on everything. Number one, it's going to put you at a higher risk of diabetes and hypercholesteremia, where you have high blood cholesterol. That in itself is going to put you at risk of developing heart disease and strokes. So, you know, the list just goes on. And there's new research coming out now. There's a research that is being done at the moment where they're finding that getting rid of this fat from the liver and the pancreas is fundamental in the treatment of insulin resistance and diabetes. So there's going to be some exciting new studies that are going to be coming up where they're focusing on removing that fat from the liver and the pancreas. So I would think that's a very, very serious condition.
How is this removal of fat from organs done? Is it done through chemical intervention, drugs, natural therapies? What options do people have?
You know, surprisingly, for many years it was thought that it's not possible to do this, and it takes time, dietary changes. There was a study that was done where they focused on people that have had gastric bypass who are morbidly obese, and that was the only solution for them to lose weight. And many of these patients were already diagnosed type 2 diabetics on probably oral hypoglycemics or even insulin itself. And what they found was that when these patients had this gastric bypass and the weeks leading up to the gastric bypass where they had to be on a liquid diet, they found that after the gastric bypass surgery, these people weren't diabetic anymore. So a professor in England by the name of Roy Taylor, he put patients on a very, very low calorie diet, extremely low, where they were allowed 2 protein shakes a day and only vegetables, no red meat, no cheeses, no carbohydrates, just vegetables, steamed vegetables, certain types of low carb vegetables, not all, and 2 protein shakes a day. So I think it was about 600 calories they were allowed a day, and this was done over 3 months. And what they found was about 80% of the patients that were diabetic when they started this year, the diabetes went away. They didn't have the diabetes. So now they're doing a bigger study on a bigger scale where they're not actually even giving any medication. It's just diet and lifestyle modification, but over a long period of time, and this can be done. It's interesting.
It can be done, and yes, you're quite right in saying that it is very interesting. Unfortunately, sometimes we're faced with the problem that patients want to come in and get the quick fix. They're not willing to do the work, and this is a lot of work. I mean, to be on a 500 calorie diet or 600 calorie diet per day for 3 months is a lot of work for individuals to do. Is there anything else they can do? Home remedies, cinnamon, I've heard lots of these things going around. What else do you advise?
Okay, a very good point. I think that there's a lot of people that want quick fixes. In our rooms, we find patients coming and asking, I've got a wedding coming up, I need to lose weight in 2 weeks, what can you do for me? And I'm not a big fan about that. The weight loss program that we run, we want it to be a lifestyle modification. I think the biggest mistake that patients make is that they want to take their existing diet and they want to change it so drastically that they get bored and it only lasts about a month or two and they're back to their old habits. I think the transition, the first thing I always tell patients with weight loss, it starts with your mind. You need to get your mind around it because there is a form of food addiction itself. So you need to understand that the food is causing harm to your body, and you need to reverse this here. So I would suggest that if a patient is diabetic or wants to control or improve their diabetes, the first of the thing, they don't have to go so drastic. This is, as I said, that drastic route is for a select few patients. And I would say at the beginning, when they've just been diagnosed with diabetes or the insulin resistance, they are candidates for that. For patients that are on insulin and things like that, I would stay very clear about from this diet. Simple choices, okay? If you put in more sugars, refined sugars into your body, it means that your pancreas has to work much harder to process the sugar. So cutting out all these refined sugars that we weren't supposed to eat is the first step to it. That's number one. Number two, exercise. We live very sedentary lifestyles. I have patients that even if the shop is a kilometer away, they have to get into their car to drive there. And I mean, these are things that needs to change. We need to become more active.
Okay. There's one more condition that I'm quite interested in, and it seems to cause a lot of weight gain in female patients, particularly polycystic ovarian syndrome. What can you tell us about it?
Okay. Polycystic ovarian syndrome has been getting a lot of attention from media and from everyone. And here again, it's a hormonal imbalance. We're not ideally sure what causes it, but in polycystic ovarian syndrome, we have insulin resistance as at the forefront. So the patient is insulin resistant, right? We find high insulin levels. The other thing that we find is that they have high androgen levels or male hormones. So those patients typically present with weight gain, right? The first thing that a female will notice is the periods are erratic. They will find that it'll come, it'll not come. Some days, some months she'll skip the period. A lot of pain. It won't be ovulating, so infertility issues. You know, they've been trying for so long and this is not happening. Acne, right? Especially if the acne is moving into your mid to late 20s, into your 30s. Hair loss, we find frontal hair loss, you know, frontal baldness that occurs. And then we have to ask the poor husbands, because there's a little bit of aggression, especially with that testosterone that's flowing through the female section. So there's a lot of, it's a very complex disease, and it's something that is, it's gaining, you know, there's a lot of people that we are seeing as before.
I think you're right in saying it's quite complex. It's multidimensional in many ways, and people have very great difficulty understanding it and putting the pieces together. But it does affect a lot of different things at the same time.
Yes.
A good question I'd like to ask for the viewers out there is, what age group does it affect? Does it affect all women? Because I know it's starting to get diagnosed at a later age, but can it affect younger kids as well?
Definitely. I think you know, anyone that's gone through puberty, even from puberty, it needs to be, you know, they need to be checked up. We find that it's starting much more earlier, as I explained to you, with insulin resistance starting earlier. Once a female has gone through puberty and they are experiencing any of the symptoms that I've described, so the weight gain, the severe acne, the thinning of the hair, the aggression, even signs of acanthasis nigricans, what I was talking about, the darkening of the skin, they should be investigated. You know, they should have the ovary scanned, ultrasound scanned to see if there's any cysts that are developing. There are blood tests. Patients are very frustrated because polycystic ovarian syndrome gets, you know, it's an underdiagnosed condition. A lot of time, doctors tell them you need to lose weight, but they try to lose weight, and they think that they are going on, you know, like brown bread and brown rice and this and that. In actual fact, that's actually worsening the polycystic ovarian syndrome. So yes, it is something that's very complex. It needs to be managed properly. I think you need a gynecologist as such and a natural health practitioner. We do quite well in treating this.
I was just going to ask about a gynecologist. A lot of times also surgery may or may not be indicated depending on how severe it may be. So do you advise that a patient sees a gynecologist in conjunction with a primary care practitioner?
Definitely. I think a gynecologist will play a role in many ways, right? First of all, the patient needs to be checked for other conditions like uterine fibroids, right? And endometriosis. These are two conditions together with polycystic ovarian syndrome that can contribute to infertility. So this needs to be diagnosed. And depending on the degree of uterine fibroids and the pain and whatever is causing, surgery might be an option. But a natural health practitioner, I think, is extremely important together with the gynecologist. And the reason why I say that is because we can assist the body in balancing the hormones and returning the patient back to good health. I found that, without even instituting any natural treatment for infertility, just with getting patients to lose their weight, improve their insulin resistance, especially with the polycystic ovarian syndrome, and getting them to exercise, a lot of the patients are falling pregnant. So, even, we always joke at our rooms that we tell them, they say we're not using any contraceptive and we've been trying nothing. We tell them you are going to be very fertile. And patients laugh about it, and what happens? They fall pregnant on the program, and we have to stop the weight loss program because now obviously the patients are pregnant. So we've had cases where improving their lifestyle has changed that. So I would say gynecologist and a natural health practitioner, definitely.
What tips can you give the viewers that they can take home with them about managing their health, managing their weight loss, and just staying natural and staying healthy?
Okay. I find that patients do, when they look at their diet, we find that a lot of people firstly skip meals. Okay, it's a common mistake where they think, I want to lose weight. Let me not have breakfast and lunch. Let's have a big supper. And that's actually the worst thing that you can do, because you actually slow your metabolism down and you cause your body to store, because you put your body into a stressful state, right? So first of the things is eating correctly and on time, okay? The second thing is patients, they do the Monday to Friday diet. I'm sure you've seen that also. They do the Monday to Friday diet where they're good, they do everything 100%, and then on weekends, they give it a go. So I think making healthy food choices, firstly, that's very important. Exercising. You'll hear me say this a lot. It is extremely important, especially not only with insulin resistance, with lots of medical conditions. Obviously, if you've got osteoarthritis and you've got pain in your joints and things like that, don't overdo it. Start off with very gentle exercises, right? And also the other thing about it is we have to bring into account stress. Stress is an important factor. We need to be able to control your stress in order to treat these conditions.
What are the common mistakes people make in terms of healthy food choices? I know you did mention and you did advise to make healthy food choices, but sometimes seemingly healthy food is actually not as healthy as you think.
That's very true. I'll give you an example. A patient that has now recently been diagnosed with diabetes reads that eating normal rice is not good. So they switch to basmati rice because it's low GI, low glycemic index. But what we find is when they switch to that low GI foods, the quantity is exactly the same. So they're not really making a big change in their life. You understand? If they switch from, for example, white bread to brown bread, they're still having the same quantities, which is worsening the insulin resistance. So I think what we need to do is we need to be realistic. Okay? We need to understand this condition. We need to understand that certain types of foods, even though potatoes is a vegetable, in insulin resistance, it's a no-no because it's a carbohydrate and it's going to worsen the condition. So there's certain vegetables that are good and what we call low carbohydrate vegetables, and there's certain vegetables that are high carbohydrate vegetables. And we find that people that are insulin resistant and who have polycystic will gravitate to the high carbohydrate content. Our body is so sensitive that it can actually, go in search of high carb vegetables because its blood sugar, the blood sugar in the cells are very low, so you're craving sugar all the time. So I think healthy choices are very important. Secondly, everyone thinks that fruit is extremely important in diabetes and things like that. There are certain fruits that are very high in sugar and equivalent to you eating a slab of chocolate. So an example of that is like your very ripe mangoes, or even pineapple, right? Grapes, certain types of grapes, they're very high in sugar content. And even though it's a healthy sugar, when it breaks down into glucose for your body to be used. So it's putting a load onto your system, and that is now putting a strain on your pancreas and making your insulin resistance and diabetes a lot worse. So I think we need to be educated about what types of foods that we need to eat, and obviously exercise and lifestyle modification.
Thank you, Dr. Naidu, for joining us here today on Natural Health and for sharing with us your insight on weight loss and metabolic disease. That's it from us today on Natural Health. Remember to get your natural health questions answered by sending us an email to naturalhealth@deentv.co.za and find us on Facebook by searching for Natural Health TV Show. That's it from us this week. We look forward to seeing you next week on Natural Health with me, Dr. Fatima Paruk. Until then, stay well.